All right, go ahead.
Okay, we'll call the meeting to order. Was the meeting properly noticed?
Yes, it was.
Roll call?
Josh Pozdowski,
Aye, here.
Bob Grabowski,
Yes.
Rick Peace.
Yep.
Marge Edwards,
Yes.
Gordy Carlson,
Yes.
Terry Harvey Beaversdorf,
Yes.
Got
Terry's here. Just got back from Florida.
nice. Dr. Richard Long is not on right now, and Becky Peace.
Yes,
And I have a motion to approve the agenda.
Yes. Second.
Motion by Grabarski, second by Carlson. Is there any discussion? All in favor? Aye.
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 Opposed?
Aye.
Approval of the February 13th meeting minutes.
Which motion? I'll second.
Motion by Carlson, second by Pease. Is there any discussion on the minutes? Supervisor Podolsky.
Madam Chair. I didn't see a mention to include adult crisis patients that I had made in a transparent format that is clear to the public and I. And the director's report, where I believe it should be in the manager's narratives, would be under 8.
Okay, where are you saying that this is?
It's 8. And then B. Where we had the report of department. And then we have director's report and manager narratives, where I believe it should be. Makes a mention of. To include suicide. But not no mention of my. Statement that I made in the last minutes of the meeting. To include the adult crisis patients in a transparent manner.
Kelly, do you have an answer to that?
The statement says a request was made by Supervisor Kozlowski to include suicide and APS statistics was made. We do not record verbatim statements per Robert's Rules of Order. If you would like us to request more information from Corp Counsel, we can do so.
And last meeting, Kelly, I mentioned this because we had the pediatric and child. In that were included in the last agenda. And I thought it would be reasonable to all include the adult crisis patients. So in that you said that you would be including it in this agenda, so.
We have it in the narrative for this month. There is the APS data you requested, as well as the suicide numbers that you requested. That is in our report for this month.
Okay. We've had a motion and a second to approve the minutes. All in favor, say aye.
Aye.
Opposed?
Aye.
Is there any public participation? None, okay. Correspondence,
None.
okay, we will now have a presentation for public health.
All right, I have Joe Larson with us from the Department of Health Services.
All right, well, thank you all for having me here today. My name is Joe Larson. I'm with the Department of Health Services. I work within the Office of Policy and Practice Alignment in the Division of Public Health as the Southern Region Director there. So I'm happy to be here today. I'll go through, just talk a little bit about what we did and what I'm presenting today. Just to give you a little bit of background and then present a certificate. So one of the things that we do at the Department of Health Services is what's called a DHS 140 review. It's based on the 140 administrative rule. Department of Health Services does a minimal compliance review of every health department around the state. And we do that on a rotating basis, but generally every 5 years. And so part of that process is to look at what are the minimum services that are required by state law for all health departments to do. And review and hear from the health departments on how they are meeting those requirements. The way that we've approached this is that, we work with health departments throughout the years and throughout every year, whether that's through technical assistance, answering questions, just working in general. So we come into these reviews with the assumption that the health departments and health and human services departments are meeting what's required. So really, it's a dialogue between us and the department. And it's a chance for the department to really let us know what are the things that they're doing really, really well. It's almost a chance to brag sometimes about the great work that's being done. So I have a few things that I wanted to highlight, just what we heard in the review. Some of the things that we thought would be really worth mentioning. So some of the strengths of the department that we heard are how the department leverages partnerships to meet community needs. Now, this is really important. We heard many examples of this, but some of the things that were highlighted were some of the work in environmental health, for example, how the department has partnered with law enforcement, with community partnerships, looking at doing yearly water testing to make sure the community is safe from contaminants in water. We heard about National Night Out and how the department works with law enforcement to provide community education. We heard many examples on ways that the department works with partners to promote policies that keep the community safe, such as tobacco use policies or vaping policies and things like that. Another thing that I wanted to highlight is just the work done around promoting mental health in the community. Now, this is not something that the department can do alone. It really is an endeavor that is done with community partnerships. And that's through things like trainings, through things like education out in the community. There's many examples, and I could probably talk for 20 minutes on some of the great things that we heard. But just wanted to highlight these partnerships are very important to the work the department's doing, because it's truly a community effort, and we're really happy to hear those. Knowledge of the community is definitely a strength. One of the things that is important in the work of public health is to know what is important to the community and what can be done in the community. We know that there are certain things in all communities. Every community is different, and what might work here is not going to work in another county. And we know that each county is unique. So we heard that. Speaking with the community, meeting with community partners, hearing from all of you at this table on what is important and what needs to be addressed was clearly evident. So knowledge of the community was very important. And then the last thing that I really wanted to highlight is the team culture that we heard. And it was really clear from those in this room when we did the review, how we heard from everybody at the table. There was so much passion in the room for the work that they were doing and the importance of the programs. It just really came out strong. The personal stories that we heard in this review about the work that was being done really stuck with us throughout. And it was clear that no one person on that team felt that they could do the work alone. It was truly a team effort, and there was leadership from every person in that room. So just a lot of just thanks for the stories that we heard, and I wanted to highlight that is a really important piece. So we heard many other highlights and many other stories and things that I could have talked about, but I wanted to highlight some of those major points. So I'm here today to present this certificate of designation to Adams County Health and Human Services as a level 3 health department. There are 3 different levels of health departments in the state, level 1, 2, or 3, and Adams County came into this review for a level 3 certification. So on behalf of State Health Officer Paula Tran, I'll present this certificate to Cody. as a level 3 health department. And this certificate basically says that the department has met all of the requirements that we have in statute and rule. This certificate is good for a period up to 5 years from the date that it was signed, which was November 8th of last year.
Thank you, Brian.
Thank you.
Feel free to give your speech.
Yeah, I just wanted to thank my team first and foremost because of all the, we couldn't have gotten this award without the hard work that my team's done. I also wanted to thank the Health and Human Services Board for continuing to support public health through the pandemic and as we transition through. So I appreciate all of you guys. Thank you.
Madam Chair, I'd just like to address this and thank you for that presentation. However, I did not hear anything about the opioid crisis that we're currently experiencing. Are we doing anything or initiating anything? Are you guys aware of how serious this is and what can we do about this?
Sure. Right now, public health is working really hard on the opioid crisis. We had a workshop last week. We actually just got approved through the Narcan Direct program. So we're going to be able to train the community members to get some of the Narcan out into our community to kind of help prevent that stuff. A big thing with public health to just to remind you that we're all about prevention. So we're also working on the fentanyl test strips because sometimes we're finding that opioids are getting into THC. So we kind of want to help keep our community aware with the resources, Narcan test strips. So those are some of the big things that public health is working on right now. So
You work in conjunction with I suppose the police departments and.
Yep, we're working on some grants, maybe even a vending option to kind of help get stuff out to the community and resources, but we work collaboratively with key stakeholders, other managers, like that around in the county and community, so.
I'd like to suggest that if you'd gone to the opioid session last week, you'd have had all your answered.
Perhaps. Thank you for that.
Thank you.
I did attempt, so yes, your questions would have been answered. Congratulations, Dr.
Thank you.
Moving on to new business. Rick, are you on?
Yes, I am, Marge. Can you hear me?
Yes.
Oh, we can.
All right, hang on. Hi, Marge County Board members. February report, we had 53 clients come in, met with. Hello?
Go ahead, Rick.
Okay, I met with 53, our office met with 53 clients, 338 phone calls. Had 470 entries, electronical. We had 10 outreach appointments. On the 14th February, we had a quarterly Toma VA CVSO congressional meeting. They just reported on their 3 quarters that they work with. On the 15th, we had open house with a vet center at the VFW. Met with like 6 veterans there. On the 17th, we had the WDVA monthly training refresher on knee disabilities and ratings. And then on the 21st, Scott had the mental health, the community action team, the CAT workshop. And then the 24th, we met with ADRC to go over the senior veterans fair scheduled for the 15th or 17th of May. Everything is tracking on that. We're just going to request tents and stuff for that event. And then we're also approved and received the WDVA $15,000 COVID grant that needs to be spent within 2 years. So I got to come up with a plan on how we're going to execute that yet. Have any questions for me?
Not about your report, excuse me, Supervisor Kozlowski.
Yeah, I'm looking here. My question is, this we're on item 9. Would be 2A. I think that is the appropriate.
You have a question for the BSO?
Yeah, perhaps he or Kelly can help me with this in the budget. Looking here. So it's item number 928. I'm not seeing it on our screen here, however.
Are you talking about the budget?
Yeah, are we gonna get into that next? I'll
Yeah,
wait.
yep.
I'll wait.
Okay, excuse me, Rick. Do you
Yes.
get the Wisconsin Counties Association magazine?
Yes,
Okay, because there was an article in this recent one about D2 PT. With,
Oh.
for dogs.
I'm sorry, I didn't hear that, Marge.
It's an article about dogs.
Okay. I didn't read that article.
You might be interested in looking at it.
Okay, and that was in the last one?
Yes. Okay, are there any other questions on the report? Hearing none, we'll move on to your financial report. And you had a question about this, Supervisor Petrosowski?
Yes, Madam Chair. Yeah, I'll go ahead and ask this question. Can you tell me where and the amount budgeted for the crisis facility, especially for the mentally unstable and possibly dangerous psychotic patients, as well as those who are suicidal?
Under the veterans.
Is that for me or for Kelly?
It's in the budget. I'm not finding it in the.
Yeah,
budget.
it's that. Can you scroll down, Ruth? Yeah, there shouldn't be anything on that in my budget.
Where would I find that in the budget?
I don't deal with that. I deal with veterans. I don't deal with, if I have a mentally ill patient, I contact the VA in Toma. Or I contact HHS, and then we work together to get them up to the Toma mental health ward.
Save this question for the next report, I suppose, where we can find this. Thank you.
Yep, you're welcome.
Thank you, Rick. I believe that's all.
Okay, thanks, Marge. Thanks, County Board.
Right. Okay, moving on to department report. The financial report first.
Are there any questions?
Perhaps,
Yes,
Madam
Supervisor.
Chair, perhaps we can find it in this budget report. Can anybody tell me if it's in here? I don't see.
What specific,
That's the question. In that list.
you're looking for placement for inpatient services?
Yeah, the crisis center or the
If you turn to page
facility.
28 of the financial report. Line 240E 3654335329 and 311. Those are our lines for residential and involuntary services. You'll see we have a cumulative budget for approximately $520,000.
Go ahead.
Can you tell me where these are located or how this facility works or how you operate that? A little more.
Go ahead.
So we have, as you can see, it says purchase of service. So we work with facilities where we will contract for those specific services based on the population that we need to serve, the bed availability, whether they need inpatient services for substance use disorders or mental health needs. It really depends, but you'll see that they are purchase of service contracts.
Go ahead.
No, is this equipped to handle mentally unstable patients that may be dangerous or psychotic? Are they set up for this kind of these kinds of patients?
Go ahead. Go ahead. I believe that's been answered.
That's how they're certified.
How many beds do you have at this
that would be a question that we don't contract specific beds, we contract services. So, it is dependent on the population that we need to serve, who is best to serve that population. But we do not contract beds.
So it's not, I mean, I'm not, it's not really clear to me that you have a facility to accommodate dangerous patients. Are they capable of accommodating these patients?
I believe that question's been asked and answered
It's not
at several meetings.
Depends on where they need to go.
clear to me that we have a facility that.
Patients are transported to the facilities that can handle them.
Right, but how, where do they, I mean, this is the initial placement. And how is it, how, I'm just trying to figure out how it's, you're put in this, in a safe manner and handled in a safe manner where. They're, you know, they're possibly dangerous. So how do we, how is this happening, how is this process?
Go ahead,
Taking
Kelly,
place.
you can answer that again and again.
Well, I'm just wondering, if you don't mind, I'm wondering why you bring that up in a committee meeting, that you're not gonna get an answer at the committee meeting. If they're all wrong.
It's in the budget, so to me, it'd be reasonable to know
Budget is a report.
that this facility, you know, are safe for everyone, so I think it's reasonable that I would ask them.
Supervisor, please.
I guess at this point, after hearing that same question for the last 3 months, and it's been answered for the last 3 months. I know that we have a place in Oshkosh that if we can't find any other place to take them, that's a secure facility. We've been through every time that once they do their assessment, if somebody needs to go there, they contact the sheriff's department and he's transferred there safely.
Now, do they go
And-
through the jail system or do they go, I mean, how? does
Well,
that
it all
process
depends on how.
taking place, because when they go to jail, then I understand that benefits such as Medicaid are discontinued, so I don't, it seems like there could be some kind of a barrier there that they're not able to channel through. And my concern that they might end up in jail, or that they reach a dead end road, and I'm not
I
seeing.
think you've
this.
already been told that if they
It's
go
just
to, the- if they are,
weird.
if they are admitted to the jail and they warrant an assessment, the right personnel are called in for the assessment. Or they are taken to the hospital if they were a medical need. Like I said, this has been asked and answered, and Supervisor Keys has said, at least for the last 3 months.
Now, isn't it true though that when people are jailed, that Medicaid and services are discontinued?
I have no idea,
Again, that's not a committee.
and that's not ours to answer.
The majority of the costs for hospitalizations end up being our costs anyway. If they need to go to the hospital and they meet the level of criteria and they meet the determination, it is generally ends up being the taxpayer's cost. That is how that works. Regardless of your insurance coverage, regardless of where you are in the community, it generally becomes our agency's responsibility.
Okay, moving on. I have a question on, under 49210. Page 14. There was a transfer from the general fund. I guess I didn't know what that was about.
That might be a question that if Kyle's on, if Kyle can answer that.
Yep, I'm on. What page was that on?
14.
Kyle, it's the transfer from the general fund for the $297,113.
Yep, that was a transfer that we had budgeted for. It was a transfer from the general fund. We had that in the 2023 budget. I believe we pointed it out to in the budget presentation.
Okay, was it more or less to balance the budget?
No, there were carryover funds that we had in the general fund that we no longer we no longer had them committed, so they then became unassigned funds. So it was more or less a transfer over to Health and Human Services to kind of make the department whole.
Okay, I understand now. Thank you.
You're welcome.
Does anyone else have any questions on the finances? Hearing none. We will move on to the director's report.
Are there any questions on the report and narratives?
I was gonna say it, yeah. I think it was in this report that you're, Kelly, about unwinding of Medicaid and food share. Does that mean that this upcoming reduction in Medicaid, that it's going back to what it was before the pandemic?
So the food share allocation for the month of March would be the first allotment of what their total was prior to the pandemic. So the month of March, we expect would be heavy for our food pantry use, March and April, as people get used to their new allotment.
Okay, thank you. No other questions?
I have kind of
Go ahead, Supervisor Kozlowski.
Madam Chair. We have a lot of acronyms in these reports, budgets, what have you. My question is, why aren't we including a key in the agenda to decipher these? I'm not seeing, I know we got the form, but wouldn't it be reasonable to include a key in case anybody were to look at these in the public or for review, so they could also decipher these acronyms, that there's so many. I don't know how it's possible for anyone that might review this to even begin to understand these acronyms, to be honest.
We can attach a key at the end of each narrative. Yep.
I think that would be helpful. Yeah.
Very good, and you should have also received this.
Yeah, but what about the public? I mean,
Okay,
so.
I have a question about that. Josh, you brought up that before. What is public like from this agenda? I mean, the minutes are,
Mhm.
but beyond that.
Well,
a lot of these
they-
You have to go through this.
Right, but
Before
then-
you can find out what
If
it
the
is.
minutes, if they're not in the minutes anywhere, if there's no key, then nobody, how would anybody look at this and make sense of it? That's my point.
Supervisor Pease.
Current vacancies. Social worker, billing specialist on hold.
The billing specialist actually rescinded their resignation. They decided that they wanted to stay.
Okay.
We're still gonna move forward with, yeah, it was kind of exciting actually. Because we also had an employee who left us the end of last year to work at a different county. She also came back for good. So it was two very positive things with employees deciding to stay or coming back. We are still going to move forward with evaluating our fiscal processes and seeing if there are some efficiencies. I think naturally we'll have attrition. Just seems to be the nature of the beast right now, is that attrition is happening. Regardless of how much we try to make it stop, it still happens. So we are trying to figure out if there are better ways, more feasible ways. Kyle's offered to come in and do a couple things too, to maybe have a fresh set of eyes also.
Legal case manager, two.
Two of them.
Okay.
We did interviews on Friday and are hoping that that works out.
Very good. Is Diane on?
Diane is not.
Okay, well, I was gonna congratulate her on her recent marriage.
Yes, she'll be back tomorrow.
Okay,
We'll pass that on.
all right. Anything else? Okay, Kyle, the project status report.
I could take that one.
Okay,
Bruce, if you could bring
Yeah.
that up.
I'm waiting for it to, there we go.
Yeah, it's kind of slow.
It's really slow today inside.
We talked a lot about our projects. You know, we're very eager to get the fleet vehicles figured out sooner rather than later. This isn't in here, but I know Donna, all your paperwork's done and we're looking forward to getting that bus and getting rid of the other one. So that is exciting. Otherwise, the biggest project that I would want to highlight is the realignment project for the ADRC, and we can talk about that later in the budget or later on in the meeting. Anybody have any questions?
Okay, hearing none. We'll now move on to behavior health and the resolution that you formulated.
Sure, so, back in January, I brought forward, the papers from the Wisconsin County Human Services Association. Some of the budget papers that they had put together for the upcoming biennial budget. One of them was to focus on increasing funding for crisis services. So this is, a resolution that we hope to bring forward, as a county to send down to Madison to encourage them to fully fund crisis services. Josh asked a question earlier about placements and the cost. Hospitalization is excessively expensive. And to provide crisis services is very challenging. And to do so when it's poorly funded is also challenging. So this is a resolution asking for increased funding for crisis services so that counties are paid the full amount it costs to operate a crisis program.
Kelly, do you have support from the other counties as well?
All the counties are like, this is hard. One of the biggest challenges is you have to provide crisis services to people in need of crisis, regardless of their insurance or private insurance. Most private insurances do not pay for crisis services. So we're actually at a disadvantage if you do have private insurance, which is interesting.
Madam Chair, are we going to be bringing this up for further discussion this time or for a vote?
Yeah.
So I'll wait until we do that.
Okay, very good. Okay. I figure you've all read the resolution.
Yeah, I'll move.
Okay.
The county will.
Okay, motion to approve by Gularski, second by Carlson. Now we can have discussion.
Okay. Madam Chair.
Yes, sir.
So it's not clear to me that there is a safe or a facility in Adams County or HHS for safe treatment of crisis patients, especially for those who become dangerous due to their advanced diminished mental instability, symptomatic of psychotic mental conditions. Therefore, I believe no number of crisis workers can safely and humanely treat such patients. Transparency on part of HHS has been sufficiently provided in many past meetings of this committee in regards to this topic and establishing a facility or budget that's applied for this site crisis intervention service in the county's Act 9 maintenance of efforts obligation. I believe the majority of crisis patients end up in jail or prison where Medicaid is discontinued and no mental or medical treatment is administered, or commit suicide, which I believe is an act of atrocity and a disservice to those who suffer from a mental disability and are punished for reasons of which they don't understand, for which is shameful. I pray for those that may knowingly be guilty of such deception, as I believe they may experience condemnation and the wrath of all the Almighty God. And then I have another on this resolution. I also see Harvey Beersdorf is included with my name on the signature line. So it is for these reasons that I will firmly vote no on this resolution. Thank you, Madam Chair.
One
Well, I'm gonna suggest something that's normal procedure is when this gets passed, or if it gets passed, then everyone on the committee signs that typically, whether you were in favor of it or not. And then, of course, you can argue for or against it on the board floor. But
I won't be
I mean, that's one of those things where, you know, even if you're against something, if it passes, then you're part of the whole committee. And that's not just this one.
I'm not
And this-
obligated to sign this. Thank you.
I believe Willie will have our corp counsel check into that.
Fair enough.
Okay, is there any other comments on this? All in favor?
Aye.
Aye.
Aye. Online, are they voting?
I haven't seen it from Terry. Or Becky.
I vote aye.
Okay. That was Becky, wasn't it?
That was Terry.
Harry,
Derek?
Becky, are you
Becky
on?
also, Becky too.
Okay, so then it, opposed,
Aye, Supervisor Pozdolski.
okay. The resolution is passed, it will go to the county board at their next meeting. Okay, aging ADRC realignment project.
So we brought this forward. I talked a little bit earlier that this is one of the main projects that we're focused on right now. The ADRC is a very important role for us here in Adams County, especially as we become, well, we are an aging community, but we will be one of the oldest counties in the next 10 years. So having a strong, vital ADRC is very important. So we thought we'd bring forward this agenda item to kind of let you know what the realignment project is and to give you a little history of the ADRC, why we're realigning, where we're hoping to go, and then what happens if we don't get there. So many of you may recall that the ADRC was developed in 2012, so we're a little over 10 years old. The ADRC was originally created with Adams, Green Lake, Marquette, and Waushara counties. So there were 4 counties that came together. At that time, ADRCs coming together in a regional format was heavily incentivized. There was also a financial incentive to regionalize. Early on in the development of the ADRC, there was a lot of communication, a lot of meetings, routine meetings, where a lot of issues, expectations, concerns were addressed. In 2017, Marquette County decided to pull out of the ADRC and they decided to do a standalone ADRC. That was something that they were doing some internal realignment themselves and working with their aging department to help me with the word, Donna, to merge, I guess.
Yeah.
Co-merge, to co-locate. So it was advantageous for Marquette to lead the consortium. So that left Adams, Green Lake, and Waushara. We continue to remain a consortium. However, as we became more aged consortium, our meetings we didn't have as frequent meetings. Each county started operating kind of in their own silos. And in 2022, we started having conversations both internally and externally about, are we going to stay together as a consortium or do we need to have individual ADRCs in each of our counties? So we met with Marquette County, asked them what their process has been like, what they've learned, the financial impact of that decision. And then we reached out to the state and got some assistance from the state. We discovered during that meeting with the state that it would be about a 12 to 18 month process if we were to dissolve the consortium. It would take an application process and we'd have to start kind of all over again. We'd have to figure out our staffing patterns and really determine the financial impact to do that. The other thing we discovered was that there is that financial incentive to be a region. So if we split up, we would lose that financial incentive. The ADRC funding has not changed since 2010. So if you figure 2010 to where we are today, things have cost different than they do now, did then, so. It is advantageous for us to stay together financially. There are some real strengths with being a consortium of collaboration, shared services, shared staffing. So the 3 counties agreed that we would remain together, but that we needed to have a new focus and we needed to realign and refocus on that collaborative relationship. So starting in October, we had our first realignment meeting. We are now meeting every month from anywhere from 2 to 4 hours a month to focus on the things that need to be realigned, looking at our financial pieces, making sure our budgets are equitable, looking at staffing, making sure that if we have shortages with our staffing, that we're able to share staff, and really just reinvigorating that consortium feel. So we're very excited about it. We're a couple months into it now. We do plan to reevaluate where we are with the realignment process. We don't want it to be something where we all sit around the table and talk about change and have great ideas and then nothing happens. So this fall, we do plan to look at where are we? Are we where we need to be? And if we're not where we need to be, we would be coming back to this committee to talk about creating a standalone ADRC. And then we would fold you into that process because it would be a 12 to 18 month process. And we would be looking at possibly standing alone in 2025. If we aren't able to be successful with this realignment. So Donna and I thought it was important that we just gave you a little bit of a background onto why we're doing the realignment. It is a lot of work. It is intentional work, but we are hopeful that this is going to be what's best for the consortium. I don't know if there's any questions.
Having an aging population, are we kind of spearheading this to the other counties? Or are they spearheading it to us?
I would say we probably started the conversation.
They don't want to lose us.
Well, I think it was, you know, sometimes when things seem to be working, it's like, why fix it if it's not broken? But it wasn't, I don't think it's where it could be.
Okay.
Really was sharing services, and I think that was really where we were coming from of. Let's create some efficiencies, let's really look at this fiscally, let's really make sure that as our population's aging, we're gonna be able to meet the needs of this population.
There were just some questions like, in Green Lake, they have a more wealthier population than we do sometimes. So we were asking, well, where's our, we just want to make sure we were getting our fair share of the consortium, that we were, being able to serve our citizens of Adams as well as Green Lake was able to and the share. So we just really wanted to put it out on the table, make sure that we all understood the process, what we're all doing, and that we're all treated equally and fairly, and make sure that our staff are not overwhelmed in one area when we could be sharing and so forth. So we did ask, and the other 2 counties were right on board with it and said, yes, we definitely want to stay together, but we definitely make sure that it's working well between the 3 counties.
How do we compare age-wise with the other 2 counties, especially if you'd like to take me out or take me out, and still be.
And then we're pretty young then.
Well, I think at least half of the county, was in for fishing. We could go at Skillet. Wow.
Right,
It's the first time I'd ever been there. It was crazy. And they did well. They did very well. Taken care of. So anyway, getting back to the original question, how do we compare?
Well, I actually looked up numbers in this for our next aging advisory board meeting, but we are probably the 5th fastest growing aging population in the state right now. We might even be 4. And so we are definitely, that's out of 72 counties. And so we are definitely growing one of the fastest here in Adams. And our aging population, I think in Green Lake, it's still around 20% we're at 31, and we're estimated by 2040 to be at 50%. So the estimation is just going up, so.
Rick, have Jake reserve me a spot.
When this originally was set up, did the state tell you who you can partner with, or we just reached out to the other 4?
It was a very natural relationship between Washera, Green Lake and Marquette. We have a lot of very similarities with our populations. We were also in some other collaborative relationships. We had a community response program where we had a grant that we shared, the 4 counties shared this grant through child welfare. These 4 counties are also part of our Central Wisconsin Health Partnership. But it's just a very natural relationship. I think we've had strong ties with those counties also. So, and they're great partners. I mean, I want to make sure that everybody walks away knowing that these counties are good partners.
The only reason I asked that question, because you said about the economics with Green Lake, I'm thinking Juneau County aligns more with our economics, and how come
But-
we didn't?
Because Adams County was the last one to go into, one of the last to go into family care, one of the last ones to go into the ADRC process. So Juneau County was already part of a 5-county at that time. So a lot of the counties had already been kind of gathered up. And so the plan was always to have Adams as a part of that because of the relationships. But it was just took a little bit longer to get Adams into the consortium.
This wasn't the same deal from years ago. We had the consortium that included Sauk, Juneau, Adams.
Nope,
Something
that
different?
was our environmental health.
Yeah.
And then we still have the nurse family partnership with Sauk, Juneau and Adam.
All right, thanks.
And really being able to have relationships with other counties is very beneficial.
And they do things differently, like in Green Lake, they have transportation's different, and the ADRC runs a little, or the aging runs a little differently. In Washera, they run, so we learn a lot from them for our aging division as well as the ADRC, so we work very well together. And we learn a lot from each other, and it doesn't mean that we don't call Juneau or Sauk County sometimes too, because we learn from other counties, but these are our partners and we work really well with them, and we'd like to stay as a consortium if it benefits the citizens of Adams.
So that's really it. You'll see this as our in our project status report. And maybe if we make some exciting strides, we might bring it back as an update, or maybe in a couple months, just an overview, because we don't want anybody to feel surprised if in the fall we're like, hey, this didn't work. We want to make sure everybody's kind of on the same page. We are very much hopeful it will work though.
Any other questions, comments?
Can I make one more question or comment on that last resolution? Madam Chair?
What is it you want to say now?
Well, I see Governor Evers was in that, and I'm wondering why this hasn't been brought up in the past 4 years by his administration.
We can't answer that question. This is a resolution. It's
He was included in it, so I decided.
because the resolution will be forwarded on to the state.
Well, I guess I'll partially answer that. I'm sure because he is also submitting a budget, we'd like to have that in the budget. That's why they include his name in there.
Thank you. Appreciate it.
Okay, next meeting date, April 10th. Is that okay with everyone?
But, yeah, that'll be good. Same time, same place.
Yeah.
Take it. Yeah.
Nothing else? This meeting is adjourned. Thank you.